Congress is down to a couple of weeks to agree on spending plans before another shutdown deadline. One key spending item is health care. Dakota Territory's Blake Trolley has been tracking the situation.
Lawmakers are currently negotiating a path forward for health care following last year's government shutdown over the issue. One option on the table is a 3-year extension of Enhanced Affordable Care Act subsidies, which passed the House earlier this month. The Center for American Progress is cheering on that proposal.
A clean 3-year extension, honestly, is the easiest way to hold, the millions of Americans who rely on marketplace coverage essentially harmless for the premium increases.
Senators have been meeting and discussing proposals around the subsidies that both parties can get behind to secure a health care deal.
These are proposals that should have been explored months ago. We knew that the enhanced tax credits were expiring, and the time for these policy tweaks and these discussions honestly have passed.
Murphy says the changes made could work for 2027, but fears the health care marketplace would not be able to adapt to any such changes this year. On to the negotiations themselves. Senator Mike Rounds told Dakota Territory News Sunday that the 3-year extension of the subsidies in its current form likely won't pass. Rounds says lawmakers are looking at extending the subsidies with changes made.
I think number one, we're going to get rid of the graft, the corruption that was in the existing program. Literally $35 billion in losses on this. We're not going to let that happen. Second of all, we're not going to allow taxpayer monies to fund abortions as a part of this health care plan. There is a path forward. I think a number of us have talked with our Democrat colleagues about it.
Round says he's hopeful lawmakers will find a solution.
There's probably 75,000 people in South Dakota that will see their prices go up. There could be as many as 18,000 people that decide not to continue their health care coverage within South Dakota. We don't want to see that happen. So if there's any way at all that we can do this, but still make sure that taxpayer dollars are being spent correctly, we have an interest in finding that. But once again, there are limitations on what we're going to do.
The issue around abortion appears to remain a key sticking point. Reporting in Rapid City, Blake Trolley, Dakota Territory News.